Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I am going to teach you on how to use crutches. There was this time Nursing and Midwifery Council of Nigeria set exam question on how to use crutches. The question indicated that a patient has had an road traffic accident and he has been hospitalized. So it is your responsibility now. After a while, the patient is about to be discharged. So as a nurse, as a student nurse, mobilize those patients, teach the patients on how to use crutches. So sit back and watch this video till the end. Do not forget to like, share, and subscribe to my YouTube channel at Nurse Clement B. Please share, like, and drop your comments, right? So what is crutches? Crutches are sets of walking aid that people use to support themselves while walking, and it comes in different types, right? As a student nurse, it is important that you have the skill on how to teach your patients how to use crutches before the patient is being discharged home, so that he can move around. That is the aim for these crutches, right? So sit back, do not go away, watch this video till the end. Do not forget to like, share, and subscribe. So if you're going to use crutches and you're going to teach your patient, remember, it's just like a health education when you are going to teach a patient on how to use a particular instrument or on how to prevent a particular disease, right? So you have to show the patient on how to use these crutches, right? So make sure that the pad at the top is the crutches is well padded, and make sure that the arms is also padded, right? The armrest is also padded, right? And also the tip of the crutches is also the tip is padded also, so that it can maintain balance while the patient is using it. Do you understand? So the next thing is that you have to observe. Also, you have to adjust the crutches to the patient's height. When adjusting the crutches to the patient's height, you have to press this button, right? And then push. Use this button, press it this way, and then push it inside. You keep pressing and keep adjusting. So remember, the crutches, it has a number. It's been numbered in inches, 5.3, 5.2, 5.4. So you keep adjusting. If the patient is short like me, then you adjust it to the last. And the height of the patient will be the height of the crutches will be prescribed by the doctor, so that you can follow according to the patient's height, right? So remember, when you want to teaching the patient on how to use crutches, make sure that your 3 fingers in between the crutches and the patient's arm, your 3 fingers can go in comfortably, right? These 3 fingers, make sure that it can go in comfortably, right? Okay, make sure also that when you are adjusting the crutches, the handle, this is the handle, right? The handle, the patient's wrist should be at the same level with the handle, right? At the same level with the handle. And then do not allow the patients to teach the patient not to bend, to avoid applying pressure on the nerves around the axilla. This causes numbness and tingling around that area, right? So make sure that you adjust it properly and the patient can hold the handle properly. So now the doctor will also prescribe what type of weight, the type of weight that the patient should apply while walking. So we have non-weight bearing or no weight bearing, partial weight bearing, and full weight bearing, right? So for this video, I am going to concentrate on non-weight bearing, that is no weight at all. This implies that the patient, no weight bearing implies that there should be no weight at all on the affected limb. That means when the patient is using the crutches, the affected limb will be lifted completely off the ground. off the ground. So for this video, I'm going to concentrate on no weight bearing, right? So now after achieving this, let's use the crutches. So you ask the patient to like hold. For example, remember we are doing no weight at all. So the affected limb, it's going to be off the ground, off the floor completely, and then ask the patient to make to push the crutches forward according to the patient's step, not too wide, right? So now like this, since we are doing no weight bearing, push the crutches forward a bit and then you jump, right? And push the next step and then you jump. Remember, it's no weight bearing, right? Then you turn, make sure that there is no weight on the affected limb, right? No weight at all. And then while turning, be careful so that you will not injure yourself. You turn properly, right? So now from standing to sitting, right? So while the patient wants to sit after walking, you tell the patient also to like bring yourself closer. Make sure that the back of your foot is touching the chair, right? The back of it, like the way the back of my legs are touching the chair, right? Then you remove both crutches, put them together in one, the left hand, and bring them to the side this way. Then use the other hand and then support yourself on the armrest of the chair, and then you sit down, right? Remember, it's no weight. So the next thing is for you now to put the other crutch down flat, and then remember it's no weight. Then you turn this way and then place it on the chair, and then you support your leg on the crutch this way, right? Because you are supporting the affected limb. Always also remember, before you start, you have to tell your patient that he or she must use a comfortable shoe, the shoe that will not make the patient slip, the shoe that will not cause more harm, accidents, so that the patient will be comfortable walking around while using the crutches. Now, from sitting to standing, let's look at how to teach our patients on how to do from sitting to standing. So while doing from sitting to standing, you wear your shoe back, right? So as the patient is sitting comfortably on the chair, right? So encourage the patient to pull to the edge of the chair this way. Come to the edge of the chair and then lift the crutches, the two crutches, from the floor, making sure that the two crutches are of the same height, and then put them together. Place your non-dominant hand on the handle and support yourself on the armrest of the chair and lift yourself up. Let the patient stand up and immediately separate the crutches. Let the other one be in the non-dominant hand and the other one the dominant hand, right? Make sure that the shoulder part, your armpit is on the shoulder part properly, and your hands are on the handle. So now we have done from sitting to standing. Then since it's no weight bearing, then the patient push the crutches forward and then jump and then continue. I hope that next time if you are asked to teach crutches or how to mobilize the patient before discharge, you can be able to say something during OSCE, during practicals. So thank you for watching. If there is any comment, if there is any procedure you want me to do, please drop it at the comment section. I love you all. Nurse Clement B saying bye-bye.